Hello, everybody. My name is Benjamin Day.
And I am Jillian Mason. And today, I am sitting in front of an Emmy Award. I just wanted to point that out. Yeah.
Do you want to explain that?
No. I mean, you can't even.
Did you win something?
I've won nothing. But I am. I'm recording since my home is now being dismantled by construction.
I see.
I am recording here at the home of poli-sci professor Dr. Misty Parker and Emmy award-winning journalist Katie Worth, and hopefully the presence of the Emmy in the background and the energy that's been left here by these two very smart women is going to fuel us through this podcast today.
It'll at least fuel you, probably not me at all. I had a brief moment of hope where I was like, are they giving out Emmys for activism now? Maybe we can accomplish something recognized in our life.
Best hidden in an intersection.
Well, if we didn't mention it already, this is the Medicare for All podcast.
Oh, yeah, it is, right?
Everybody that needs health care. So here on our podcast, obviously, we love calling out the bad actors in the healthcare system, greedy insurance companies, soulless CEOs, and Big Pharma, profit-hungry, so-called nonprofit hospitals. I'm putting that in quotes if you're listening on the podcast in the audio format. And all of the other villains in the healthcare system, which we have way, way, way too many of. So, we look at the ways that all these predators target sick people and poor people for exploitation. But today, we're looking at what happens when they start fighting each other for a bigger piece of the pie. You would think that would be a good thing, like watching a cage match between your least favorite people, but it turns out not to be that great for us. So, specifically, we're going to look at the world of hospital consolidation. That's when hospitals merge together to form giant corporate entities that are called health systems. The health systems often include hospitals, but they also have like health centers. They have clinics. They have outpatient services. They have physician networks. They have everything. And what does hospital consolidation mean just for regular people like us? So no spoilers. Maybe this will be a bit of a spoiler, but it turns out when giant healthcare monsters go at it, much like Godzilla taking on Mothra, it is the rest of us tiny humans who suffer. It feels exactly what it's like to navigate the healthcare system. So
yeah, it's good stuff, right? So like hospital consolidation sounds boring, but when you say that it's just like Godzilla and Mothra, who couldn't be interested?
Mergers and acquisitions.
Mergers and acquisitions. Yeah, we're going to be using a lot of weird capitalist language that's very strange to us on this podcast. But let's just start, right? So we're in America. I'm in Texas. Sorry, Ben's in America. And we fundamentally believe, both in Texas and America, that bigger is better, right? So you want a bigger shopping mall, you want an all-you-can-eat buffet, you want a bigger truck and a bigger SUV. So what could possibly be wrong with having a bigger healthcare corporation?
Well, it turns out a lot of things can go wrong. And for the record, I am all in favor of the all-you-can-eat buffets. SUVs and trucks, maybe we don't need this.
Oh, I can't wait till you come to visit them, because Texas buffet is mwah.
Yes. Oh God. I want that brisket. So I'm going to tell you a little Massachusetts-y story. You say we're in America, but I think we may be in Russia if you ask someone in Texas.
Oh dear.
The Soviet homeland. So anyway, here's my little story. Back in the 1990s, two of Boston's biggest hospitals merged to create this mega corporation called Partners Health. They actually just renamed themselves again, I think. I don't even know what the new name is yet. And over the next 2 decades after that, Partners bought up like everything. They
Mhm.
merged in all of the health clinics in the greater Boston area, other smaller hospitals. They just became this behemoth that was providing, way more than half the care in Massachusetts. So why did this happen? And this is, I think, a common story that a lot of these mergers started in the 90s, these
Right.
mega mergers, even though they continue today. Why did this start happening in the 90s? Well, because that's when the early 90s is when all the insurance companies were merging and consolidating, and they were launching, managed care, which we've talked about on the show. This is all the things that you hate in
With
life,
some
probably.
disdain. Yeah, we've talked about
Yes.
managed care with a great deal of disdain. Yeah.
Managed care, that's the pre-approvals. That's insurance companies denying your claim after you've already received the care. All the really, really nasty shit
Mhm.
that insurance companies do meddling. But part of that managed care era was insurance companies were like, we're going to get really big, and that will let us negotiate lower prices from hospitals. We'll have all this power. We can squeeze hospitals and force them to provide services for less. So
Mm.
hospitals were like, great, now we're going to merge and turn into these mega hospital corporations, and then you can't do that anymore.
Yeah.
So it you would think maybe if hospitals merged that they would then be able to negotiate the higher prices. Well,
Yeah, because
here's
like
what
if someone's I
yes.
mean, if someone's gonna take on the insurance company, like, yeah, go for it, bro. You know?
Yes, although the higher
Okay.
prices not great. Those get passed on to us. But
Oh.
what happened was something actually completely unexpected. Now there's this very famous sort of investigative journalism piece that was published in the Boston Globe a bunch of years back, and they uncovered what had happened was that Partners was huge. There was only one really giant insurance company in Massachusetts, Blue Cross Blue Shield. And what they did was they got together in kind of a closed door setting and they said, let's not fight. Let's just both get rich off of this healthcare system. So they both basically, Blue Cross said, okay, we're not going to try and negotiate low prices with you. You can just charge us really, really high prices. We'll pass them on to the consumers. And then what Partners got in exchange, or what Blue Cross got in exchange for paying these high prices to the hospital, was that Partners agreed to force those same high prices on the other insurance companies, not to
Oh,
let the other insurance companies underbid Blue Cross. So they're
fantastic.
like, we're just have a little handshake deal here where we're going to jack up prices really, really high in the coming years. We'll pass them all on to the poor suckers who pay their health insurance premiums or have it deducted from their paychecks, and we're all going to do really, really well under the system. So that's what happened behind closed doors, and lo and behold, prices skyrocketed in the Boston area since then. We still have some of the highest healthcare prices in the country, and I suspect this is not such an unusual thing. I think the only unusual thing is that a reporter got a hold of this story and published it.
Yeah, yeah, no, that's my impression as well. I
Right.
used to be friends with a partner's lobbyist during this period. She shall
How
be
do you explain
unnamed.
that?
Um, well, let's just say that healthcare reform tore us apart.
Yeah.
Um, there was a little, I don't think you respect what I do, and a little, I don't think I
You're
do.
right. A former friend.
Anyway, so
So,
yeah, so
yeah.
partners, and anyone who lives in anyone who lives in Partnerschusetts, anyone who lives in Massachusetts knows Partners and has had to fight with them at some point, whether it be for coverage or whatever.
Right.
It's awesome.
Yes, they have a new name though. They're now called Mass General Brigham.
Oh,
They renamed themselves to the original name of the two hospitals that merged. It was Mass
that's great.
General and Brigham and Women's merging together. So I don't know. When you get a bad name, when everyone knows you and hates you, you just change your
Mhm.
brand.
But that's like Apple rebranding to iPhone, right? Like
Right.
one of their popular products. And then
It's true. It's
you know,
true. We know who you are.
we know you. We see you. Another group of people we see, right? This episode was actually inspired by our friends at the Minnesota Nurses Association. Shout out to our beloved Jerry Katz. And last year they were actually fighting a proposed merger of Fairview Health with Sanford Health. And those are two giant corporations with dozens of hospitals and clinics, right? But fortunately, the nurses and the Minnesota patients got together and actually won the fight, and the merger talks got abandoned. But consolidation across the healthcare system in the US has run rampant for the past decade. And so every possible healthcare corporation is just merging with every other possible healthcare corporation. Hospitals buying other hospitals, for-profit private equity firms buying up anything they can flip for a short-term profit. Insurance companies buying hospitals, retail pharmacy chains buying pharmacy benefit management. Oh God, I just hate all of it. I just hate all of it.
Jillian really likes writing things for me to say on the podcast that are like, she knows are going to be awkward or embarrassing coming out of my mouth. I took a certain relish in writing that last paragraph for Jillian to say out loud. It was like the tongue twister challenge. Like, fuck this, I'm quitting.
Also, fuck this, I quit. Yes. But so basically at this point, right, it's like impossible for like a freestanding independent physician to practice on their own, right? This is like, it's not
when I was a kid, I had my pediatrician was an independent primary care doctor who practiced out of the first floor of his house. And it's like, those days are rapidly gone, I think. But can you tell me a little bit more? Because we're mostly talking about the hospital mergers, like the big provider systems merging together. But it does seem like consolidation is happening kind of across the board, both among providers, but then also like vertically with like insurers and others. So what's the broader landscape here?
Yeah, no, you're right. It's like a big clusterfuck where everyone's doing everybody.
That sounds a lot nicer than this.
I know it does, doesn't it? It really spiced it up there for you, eh? All right. So we got a bunch of different kinds of consolidation. And so one kind of consolidation is vertical consolidation. This is like the healthcare equivalent of vertical integration in the business world. I don't even know how I know that term. So basically what that means is that there are like a bunch of different providers, right? And they offer different services along the same supply chain. So like basically a hospital would acquire a physician practice so that the, Brigham Women's would acquire your, first floor doctor in his house, his practice, right? And then they would have another physician. So this is all like there are different kinds of consolidation happening there in that like vertical way. Insurers are actually consolidating with provider entities. And surprisingly, at this point, actually, the largest employer of physicians in the US is now Optum, which is a subsidiary of United Health Group, some of our favorite people.
That was crazy to me when I saw that an insurer is the largest employer of doctors.
This is so
but I guess it's kind of like the logical conclusion of the story we told about Blue Cross and Partners. Just like, man, why are we fighting, man? Why don't we just both get rich together? Like they could just merge and drop the pretense, right? That there's an actual market taking place. Yeah,
that's a sweet ending. Can't you see you love each other? So that's vertical consolidation.
Power couple.
Yes, power couple. What we're talking about here, though, is horizontal consolidation. This is like the vertical consolidation. That's for another show, right? Today, we're going to really focus in on when two like organizations come together and integrate. And basically what that means is like when two hospitals consolidate through a merger or two big health systems consolidate, which is, all very scary. But so these different kinds of consolidation are definitely related. But again, today we're just going to mostly focus on the consolidation of hospitals because we know that a lot of people experience their healthcare through these major mega hospitals and are wondering, why does my hospital's name start changing every time I see it? And so one of the kind of important kinds of consolidation that I want to just like kind of highlight here, though, is the horizontal consolidation. It's a cross-market merger, right? And that's a merger between two healthcare providers that operate in different geographic markets for patient care. So this could involve hospitals, health systems that are in neighboring markets, or it could just be entities that are hundreds or even thousands of miles apart, right?
So, like, I think that Minnesota merger that didn't happen, that was one of those. I think Sanford was like a South Dakota-based hospital system, and they were going to buy out this massive Minnesota system, so they would span like multiple states.
It's interesting to me because, like, in the most conservative parts of America, regionalism is really big and important, right? Like, so, like Texas, for example, right? Texans don't want. We have like signs on our highway that say like, "Don't let Californians come and change our politics" or whatever. So Texans don't want a Californian or a Massachusettsian, Massachusettser. Massachusetts. Anyway, they don't want
Masshole, I think is the official term.
the way that they talk about it is like, no, we should have the opportunity to like locally control the way things are. This is like the states' rights argument, basically. And so it's really funny that it's like their kind of version of capitalism that has actually enabled a world where your healthcare could actually be controlled by someone in Massachusetts at Partners, even if you live in California.
Right. Lovely.
So
just like Texas controls its own energy grid. It's working swimmingly.
Hey, I want to knock wood.
I think that Emmy is working on you because you said cross market mergers. You introduced us to. We're talking like smart people today, so things are happening over there.
Thank you, Katie and Misty. But so and then the impact of this is nuts, right? So like a handful of studies are basically showing that these cross-market mergers, people have only really begun to study this stuff right now, but that they can lead to increases in healthcare prices, and that those hospitals may become less responsive to community needs, which makes perfect sense.
Shocking.
Are you saying that Ben in Boston doesn't understand our community needs in South Texas? Shocking. So a bunch of different antitrust agencies have started to like take a closer look at these mergers and looking especially across the ones that happen across different geographic regions. And so basically they're investigating this, but they've yet to actually fully litigate a cross-market merger.
Right. And I think in addition to the impact on patients, we should also flag the impact on hospital workers who might even get it so worse. We talked about this a lot in the episode we did on safe staffing ratios, and just how the transformation of the hospital system into like these giant mega health systems that are run by, MBAs, people who don't know anything about healthcare. They just know about, making profits essentially. And they really put the squeeze on hospital staff, which I think also then that impacts patients down the road when they're, slashing staffing ratios and stuff. And then you have these catastrophic impacts on the quality of care. So yeah,
it's like a daisy chain of fuckery.
Right.
Cool. Cool. So, I mean, we've been talking about this and we keep saying like that this is like having a big impact, transforming healthcare, blah, blah, blah. But how common actually is this? Like, is it big enough to make a significant difference because we're always getting screwed by the healthcare system, right? So how is this different from our usual screwing?
Yeah, I wasn't sure about this because I was like, well, maybe, we have kind of a similar sized healthcare system that's just getting merged into fewer and fewer hands. But actually, it turns out that our healthcare system is shrinking. So basically, and the size of the shrinkage is shocking. So since basically in the United States, we had an increasing number of hospitals and a growing number of hospital beds all the way up through like the 1970s. And then after the 1970s, everything starts going to shit and it starts moving in the opposite direction, right? So since 1975, the number of total hospital beds in the United States has dropped by more than 50%. So in 1975, we had just over or just under 1.5 million hospital beds across the whole country. By 2021, we had around 900,000 hospital beds. So from 1.5 million to less than 1 million beds. Now,
Well, that makes sense because there are fewer people now, right?
oh,
Oh,
of
wait,
course,
no,
yes, the
no.
famous shrinking population of the United States.
Oh, wait,
Um,
no. That's not it.
and you might remember remember the little COVID pandemic thing we had that just like passed through briefly,
Fading into fading into the
and
past.
how it completely overwhelmed hospital systems that were running out of beds, and people
Yeah,
were being rerouted to like different states to be treated at a hospital. And remember, at that time, we were looking at how countries like Germany had way more hospital beds per population than the United States does. Ours is very low.
right.
Well, guess what? We weren't that bad, but we've had just plummeting hospital capacity in the United States. And along with the hospital decline in hospital beds, the number of actual hospitals has also plummeted. So this is slightly different data. I'm looking at just urban hospitals here, but in 1970, there were 783 urban hospitals in the United States. By 2010, there were only 426 urban hospitals,
Oh, Jesus.
almost cut in half, right? And
Oh my God.
yeah,
I didn't look at these statistics before we started talking. This is really
whoops,
bad.
yeah,
This is
yeah.
really, really bad.
And you can kind of guess where those hospitals were that closed, right? They're in the poor neighborhoods, they're in communities of
Hmm.
color, and they're in rural parts of the country.
Right.
Basically, anywhere where there's a lot of uninsured people or a lot of people who are on Medicaid that doesn't pay
Hmm.
as well. So, some of the forces that are forcing hospitals to close sometimes are the same ones that force hospitals to merge. Um, it's just like if you're serving sort of a low income, a marginalized community, you're probably not making as much money from our for-profit healthcare system, really struggling to get by. And so some hospitals are like, well, let's try and merge ourselves into a larger health system. Maybe we can
Hmm.
survive that way, gain some bargaining power. And some ultimately end up closing. I'm right next to the city of Quincy here in Massachusetts,
Oh, yeah.
and Quincy Hospital did both. They sold themselves into a for-profit hospital chain, so they kind of were part of this buyout and this merger, and
Okay.
then they closed 2 to 3 years later after the for-profit chain milked them of a little bit of profits and then shut them down. So it's like I feel that it's the same for-profit pressures are leading to a lot of these different fucked up things happening, like the mergers and the closings, and private equity swooping in and buying up distressed hospitals and then milking them for a little bit of cash before shutting them down. It's like
Yeah.
all in the pot here. So
Yeah. Yeah.
yeah.
Yeah. The Quincy example is particularly fun, right? Because it started out in the Caritas system, if I'm thinking correctly.
I
And
think it used to be a public hospital. I think it used to be owned by Quincy, like back in the day.
yeah.
Um,
Yeah.
and then they sold to Caritas originally, which
So that's
that
the
was
Catholic
the
Church, right?
right,
So
exactly. Yes,
yeah,
that's right.
yeah.
Yep.
And so yeah, so it's gone from public hospital to Catholic Church to major corporation. It's awesome.
Yep, yep. And they were bought out by a private equity firm too, in their dying gasps.
Sweet.
But not surprisingly, the end result has been that there's huge market concentration of hospitals in most areas of the country. So by 2017, in the vast majority of markets, one hospital system had more than 50% of market share. Just
Hmm.
looking at hospital discharges. So that's kind of the new world we're living in, and some of the impacts it's had on our
It makes
ability to access
sense.
care. So
It's totally like Walmart, right? Like Walmart comes
right,
in, takes over all the functions that all the different small shops in
right.
Main Street
Everything else
used to look like.
closes. Yeah,
Right, right. No, it totally
yeah.
makes sense. And then soon we're all getting paid Walmart wages.
Right.
That's
And there's another story that we haven't researched it, so I can't. I mean, I don't think we can go too far down the rabbit hole. But I know anecdotally that a lot of, especially health centers, not hospitals,
mm,
but like smaller community health centers,
mm,
will struggle financially, and so they'll merge into these big hospital systems,
mm,
thinking that it will help them negotiate better prices with private insurance companies. and then they find out that they are like totally screwed within those larger hospital systems, and those hospital systems do not care about health centers, especially ones that are not
Yeah.
generating profits for them. They see them as a loss, and they can be pretty ruthless once you get inside of one of those systems. So yeah.
Sad shit. Sad
Yeah.
shit.
All right. So Jillian, I guess we don't want to end with sad shit, right? Let's
No, never.
yes. So let's think about this from an organizing perspective. I think some people's natural inclination to seeing all the bad shit that happens when hospitals merge is to say we need more competition, right? We need more
Yeah.
hospitals competing with each other, and then the market is going to work its magic and lead to lower prices. We are not really a markety, capitalisty type of shindig over here. So,
Interesting.
so what's your take on that competition narrative, and what is the solution from our perspective?
Okay, well, I think like when we did a little bit, so we found this throughout the research, right? People were like, "Oh, the problem with hospital consolidation is that it reduces competition." This was sort of just like kind of the de rigueur, like every journalist
Mhm.
said this at some point in their article, right?
Mhm.
But we sort of dug deeper and we kind of figured out that there was a little kind of interesting underlying twist there, right? So we looked at like this 2019 New York Times article. This guy who's like a health economist, which is a job that shouldn't exist. Austin and he basically argues that mortality rates increase when competition falls. Wait, am I doing that right?
Mhm.
Yes. More people die when there's less competition, right? And we were like, oh, okay. So then we looked, we saw another thing in this article, and it was like, research from the Federal Trade Commission focused on the outcomes of about 2 million Medicare patients that were treated for heart conditions, right, over the course of like almost 10 years, right? That study revealed that in more concentrated cardiology markets, so where these big companies had taken over,
Right.
patients were more likely to experience heart attacks, visit the emergency department, face hospital readmissions, or even pass away. Now, part of that we definitely question. We do not know if people experience more heart attacks when their local hospital has been consolidated.
My theory, as you know, is that people were shocked by the mergers
Yeah.
and just entered cardiac distress.
Amazing. But so, we've got these two studies that seem to indicate that competition is really important, right? But we realized that the first first kind of sort of study that this was based on was actually a National Health Services study from England, right?
Right.
And then the second one is of Medicare patients, right? Which of course
Right.
Medicare does actually. So since both of those are actually universal healthcare systems that regulate the reimbursements that these hospitals can get from the government, right? So these hospitals were not competing in terms of money and cost; they were competing in terms of quality of care.
Right.
Which is a whole different scenario, right?
Not the capitalist wet dream that comes to mind when you say we need to increase hospital competition.
That's what I'm saying. Could you imagine?
Right.
So, like, if you live in England, you actually don't have to worry about what hospital is going to be more or less expensive. You're just going to go to the one where you think you're going to get the best care. Shocking.
Right. And the other weird thing about these giant hospital mergers is as insurance companies start doing more limited networks, it can become a real problem. I've been in this plan, an insurance plan, sort of a marketplace plan for years. I just switched to a new one. But for the last 10 to 15 years, I've been in this plan that does not include any of the big hospital systems. So anytime a new entity merges into partners, I would lose them, right? I would lose access to them.
Yeah.
So there's also this really kind of perverse interaction with merging of systems and limited networks at insurance companies. And of course, that's the reason they do it, is that they can get lower prices once you cut out these giant provider networks. But as soon as you do that, it's very hard to actually find specialists or the care that you need that's in your network and that you can reach by any reasonable amount of driving. So
Yeah.
mhm.
It would be awesome if we all had Medicare for all. What I'm thinking is that what
You
would
don't say.
really be the best is, and you can say
Mhm.
it with us, kids, Medicare for all.
Exactly.
We just need to get the fucking market out of our healthcare system. What's wrong? Like, what's so hard to understand?
Right. And the notion that, I think even in the economics literature, everyone knows that markets don't work in healthcare. They don't work in health insurance, and they don't work in healthcare either. I mean, I think about like Cape Cod, for example, here in Massachusetts.
Mm,
There's one hospital on Cape Cod, and the population is not so big that you need more than one hospital. So,
sure.
under what circumstances are we going to have provider competition in on Cape Cod, right? I mean, what are we going to have? Too
Mhm.
many hospitals that then compete with each other? It doesn't make any sense, right? And most parts of the country are like this, where it doesn't even, it's not feasible to have a hospital competition.
Right.
Um, who wants it? We just need a heavily regulated system where prices
Mm,
are fair across the board, regardless. I mean, if you have, like Medicare has and like the National Health Service has, sort of kind of fixed prices for all providers, I think you wouldn't see most of these mergers, right? Because getting bigger wouldn't help you to
get
squeeze
more
more
money.
dollars. Yeah, exactly. Right.
Yeah, yeah. Ultimately, this is all
Mhm.
driven by the desire to have a pool of money big enough to swim in, right?
Right.
Like a Scrooge McDuck type situation.
Right. I think that was in the remember the episode we did on
Did we already do
luxury care. Can
that's
you
right.
buy that at a hospital? Can you swim in dollars?
Oh, that's good times.
Uh-huh.
Oh man. But yeah, I mean, I think meh. Long story short, we are not advocating for greater competition in hospital. To go back to our Godzilla and Mothra analogy, right? Neither Godzilla nor Mothra is the real villain of the story. The real villain is nuclear power that created both of them.
Right.
Similarly, here, it's not the hospital, whatever. It's this whole fucking system that has created a
Right.
toxic healthcare system.
Right. And there's kind of a race to be the biggest, which you can only go so far. We've almost reached like the threshold, um, and um, and the patients kind of get screwed in the end when just like that, the partners and Blue Cross sitting down in a suite somewhere, some closed office,
Yeah.
deciding to screw everyone over and get rich in the process. So yeah,
Mm,
I'm with you. And the kind of competition we would like to see would be just like we were talking about earlier, like hospitals competing for patients because they provide better care, maybe a better experience when you go there.
mhm.
More compassionate care.
More inclusive care.
Exactly.
Yeah.
Yeah. All right. Well, we're gonna have to keep organizing. It turns out. It seems like every podcast ends this way.
This podcast is just basically a validation of why we should still have a draft.
Exactly. We're gonna have to like build a social movement or something. All right.
Mhm.
Well, I hope you all get involved with that project. You can sign up on our website if you want to get involved with organizing going into 2024. And I want to thank our podcast team, of course. Our podcast manager is Angelique Davis. Our researcher for this episode was Joanna Borla. And our show notes writer was Jerry Katz, who also kind of suggested this topic during one of our mailbag, grab bag.
Mhm.
We grabbed the mail from the bag questions episodes. And our audio editor, who is new, first episode is Craig Stanton. Thank you for joining the team, Craig.
Hey.
Joanna this is also her first episode. Actually, she did one episode when she was an intern.
You're
But
right.
this
she
is
did.
her first episode as an official, legit Medicare for All podcast researcher. So don't forget to like the episode, subscribe to the podcast on whatever platform you guys use. And the show is a project of the Healthcare Now Education Fund. If you want to support our work, give us some cash so we can swim in it. You can donate on our website at healthcare-now.org. Talk to you all soon.